is, by the way, is very healing for me, getting an opportunity to talk about this, because it seems like there is something within me that needs healing. And as much as I've worked on myself and so forth, it's good. Any opportunity that allows all these unresolved and fragmented emotions to come forward, it creates an opportunity for healing. Really, inadvertently, I have defined for you my definition of what healing is, which was more of an experiential process. Healing doesn't happen because someone gives you an IV or someone gives you a pill. I think for me, healing occurred when I created a space, when I created the context where I could put things in perspective, where there was an internal shift. I think that my healing started there. So in a way, we could say that healing is when we choose to breathe self-love, self-acceptance, and self-forgiveness to places within us that they're hurting. And whether it's a flu, whether it's a back pain, or whether it's cancer, that's a good place to start. I remember, driving up to City of Hope periodically for my surveillance and various different things, and they had this billboard that they had spelled cancer as C in red, and then answer, A-N-S-W-E-R, I think in white. I'm like, I was driving and I was relatively immature, maybe, in my process. I couldn't get it. Why are they spelling it that way? And it's only now, and hindsight is always 20/20, but it's only now that I realize that it is our choice, that cancer could be spelled as C-A-N-S-W-E-R if we want it to be. And if we stop and if we pay attention, then it can create that platform that we need for us to start paying attention and to start really breathing that self-love, acceptance, and forgiveness to places that they're hurting within us. The question that you've asked, it's a very powerful question, and it's how do you look at that? How do you, when you're sitting on the other side and when you're told that it's do or die, where do you start? When I graduated from my residency program in osteopathic manipulative medicine and family medicine, I wasn't really sure how I wanted to practice. So for a while, I was the medical director for a clinic not too far from here in downtown Los Angeles that dealt mainly with occupational injuries. And it just happened that U.S. Postal Office was one of our clients. So periodically we would get a lot of dog bites, dog bite wounds and so forth. And I started paying attention. And it was amazing. It turned out to be one of the most profound observations I've ever made. There were two sets of people. One set of people that would come in and, and they thought that I was the pit bull, that I was the dog that had bit them. I mean, they were angry. They were upset, just waiting for an excuse, okay? And, you would give them antibiotics orally, intravenously. You would send them to this orthopedic surgeon, that orthopedic surgeon. It would get, the wound, mainly their hands, would get infected, and they would have contractures or shortening of the tendons and so forth, And there was another set of patient population that I started noticing, and it was just mainly the attitudes that I started comparing. And These people, you would walk in, the wound were just probably as severe as this other category, or worse sometimes. But you know what? You would walk in, you would introduce yourself. Oh gosh, I'm sorry this happened to you. And they would look at you and say, oh, I think the worst is over, doc. I'm healing as it is already. You know, these people, it was amazing. And the beauty of it is that with the dog bite, you can't suture a dog bite wound because you have to leave it open so that it would granulate from inside, so it would heal from inside out. Otherwise, it would get infected. I mean, they would recover so quickly. It's just amazing. You know, I started paying attention and I started asking questions of myself. This cannot be this simple. I mean, it cannot be just a change in attitude and so forth. So, believe it or not, I actually looked up a veterinarian. I went and I started studying the skull and the teeth pattern of different dogs and various different things. And one thing I noticed was that when you look at teeth in various different dogs, it's not really angled outside and it's not exactly straight. It's an angle inside, okay? And so when there is a dog bite, let's say on someone's hand, and the particular bite, I think our first response is that, oh my God, the dog just bit me. And our first tendency might be to pull away. Now you see, when we pull away, that particular millisecond, it's going to determine what's going to happen to us. When we pull away, the dog's teeth literally, it will completely start injuring us. It will hook underneath our flesh, and our flesh will get ripped away because we're pulling away. Now when you look at it, what would be the right thing to do? Let's say that there is a dog bite. Now imagine, and it's a little bit graphic, I get it, but I think that this could potentially be very profound for someone. See, if there is a dog bite, now in a millisecond we realize that we don't have to completely pull away. And how can we, what are the other choices that we have? Well, there is another choice, and the choice is to literally stick our hand a little further down the throat of the dog. Well, dogs, like anybody else, we have gag reflexes. So when you stick your hand further, they literally will let go. And I think that's a good analogy for a trauma. And that trauma could be, you're just given the news that you have cancer. Now, it doesn't matter what form of cancer, you know, what stage it is, how they can manage it. To you, it's the C word. So what do you do at that stage? How do you, how can you support yourself to reside in a loving state so that you don't have to pull away? So you could sit with it. And then, when you're ready, you could check in within yourself. And you could find out what would be the best remedy, what would be the best path to take from that point on. Now see, immediately the tables are turned, aren't they? Now you're in a place of love, you feel connected, you realize that you're a divine being having a human experience, and you start paying attention. And you can partner with everyone else in a particular path, a particular program that resonates with you. And I'm here to tell you, as a cancer survivor and as a physician, that's a good place to start. Not to get frightened and pull away, but to go, if you would, along with it, within the trauma, within where you're at, realizing that we have the potential to go through this, that we have what it takes to be able to frame that issue as a blessing. And that has far more therapeutic effect than any vitamin C, than any Iscador that I can give you, or anything that I can provide you, or any chemotherapeutic agents whatsoever. And that is a good place to start. So hopefully I answered your question.